carried. All those in favor signify by saying aye. All those opposed, same sign. For the reports, first we'll do the county clerks. Is that Rachel? Rachel.
Rachel, feel free to go ahead.
Can you hear me?
Yep.
Okay. Everyone received the information in their packet for the October collections and transactions. And if there's any questions, I'll try to answer them for you.
Does anybody have anything? Betty?
Oh, I do have not so much question in regards to her report, but just to appreciate and thank you for the informational book, the green book. That was very good, and I will drop down and get more of those for distribution in my district.
Okay.
Thank you.
Great. Yes, and if anyone else would like any of those directories, we do have some down in my office, so you can just let either myself or Brooke know, and we can get them together for you at any time.
Thank you.
But thank you.
Anything else? If not, we'll go on to the election commission, which is Elizabeth.
Can you hear me? Sounds like it. Okay. So filing started today. November 27th through December 4th is the established party filing. We had a little over a handful in this morning. It was kind of underwhelming. But I do not have any lotteries for 8 a.m. There was no simultaneous lotteries for the same contest this morning at 8. We will have to see that same rule applies for the last hour on the last day. So if anyone files between 4 p.m. and 5 p.m. the last day, we could have a lottery for who's last on the ballot. So we'll have to see what happens there. But as for who's filing in our office, we've got the state's attorney, the circuit clerk, the coroner, county board, even districts, and then precinct committee persons. That's the local contests that are filing in our office. At the state level that are filing with the State Board of Elections, that would be the U.S. House, State Senate. And then the presidential filing is actually in a few weeks. So we'll just wait and see through our filing period here how many we get, if we have any objections that we have to have electoral board hearings for, and we'll go from there.
All right. Any questions for Elizabeth?
And what time is it that your office closes for each filing?
So on the first day, we are open 8 a.m. to 5 p.m. for filing. From now, Tuesday through Monday, it'll be 8:30 a.m. to 5 p.m. And then every night at 5 p.m., I will update the list of who has filed for the day on our website. So if you wanted to get an updated list each night, you could just go to our website and there'll be a candidate filings page that you can check out.
Okay. Is that it? Thank you.
Thank you.
Next, we will have the supervisor assessments. Dave?
Thanks, Matt. I'll be pretty brief. Last time I think I estimated we were going to have about 600 board review complaints. We have actually totaled those with 606. So just to give you an estimate, last time we did a revaluation in 2019, we had over 1,000 complaints. So it's about a 40% drop from what we had last time, and mainly because there hasn't been a lot of residential filings for complaints. We actually had more commercial filings than we did residential filings this year. So we're working on that. We're kind of in a little lull regarding that because we have finished 2023. We're getting ready to do 2024, and we're looking to send out our senior freeze notices either January or February, and we're looking to make a little bit of a change to those to make it a little easier for the seniors to fill out. So we worked with the state a little bit on that to see what we could do with their forms. So hopefully we'll make it a little bit easier for them to file. Any questions? Okay.
All right.
All right,
Thank you.
that's all I got. Thanks.
Next, treasurer, Nicole.
We just had our tax sale November 6th. There were 2,366 parcels that went to the tax sale for a little over 3.9 million. We had 16 buyers, including the trustee, and of those 16 buyers, one was a late cancellation and 2 were unsuccessful. Out of the 2,366 parcels, 820 parcels went to the trustee. That's probably the largest amount that's gone to the trustee since I've been in that office. The average interest rate or interest penalty did increase significantly. Last year, when you excluded the trustee and just had the regular tax buyers, because the trustee always has the higher interest penalty, the average bid was 2.13%. This year it was 4.72%. So a lot of that is because even though the legislation has capped the interest penalty to 9% versus the 18% that it used to be, with interest rates at the banks, it's more expensive to borrow money in order to use that money to purchase taxes. So we actually had some tax buyers that didn't even, that have been coming for years, didn't show up this year, didn't register because it wasn't worth it to them. They were borrowing at the same amount that they were getting, so there was no benefit to them. This was 103 more parcels than last year. Nothing too out of the ordinary, though. So now we're done with the tax sale. We'll have one more distribution next week, and then we'll have our interest distribution mid-December, and then we can finally take a breather from taxes for a while. Other than that, we'll be getting ready for audit here, and I can answer any questions if you have any. I know tax sale is just riveting, isn't it?
All right, thank you. And we have the Veterans Assistant, and I hear we have a presentation.
That is the rumor. Is it gonna be up there or no? I already turned in my report, so while they're doing that, if you have any questions on the numbers. I will say that I have, by the law, I have to turn in what we call a governor's report, which is our annual report, to Mr. Dillon. So we're working on that, have to have it done by the end of the year. I will send it to all the board members, though, so you can see, compare last year to this year. So, come on, Scott, let's go. You want to start reading it, or? Oh, okay, sure. Okay, well, the numbers I sent in was a little less. I updated them for the PowerPoint, so I'm going to go through it on that. So today, for new money, we have brought in $10,545,603 of new money, which is lump sum payments to veterans. For total money, which is the monthly income that comes in, is $69,476,377. We're about $2 million more than last year. We're probably going to go $3 or $4 million more than last year, mostly because of PACT Act. We've just seen a lot more veterans. And then to date, we have 3,351 veterans that's come into the office. 1,415 fully developed claims. What that means is just the claim was fully developed, meaning we have all the information to file. We filed 874 appeals, and then 1,315 intent to files, which means it saves the day to claim for the veterans, so they get more lump sum money. And then 1,011 power of attorneys. What that means is that gives our office representation to do the claim for free. That's it for my report. Have any questions for that?
Do we have a motion for the delinquent taxes? Betty and Sharon. All those in favor signify by saying aye. Opposed, same sign. All those. I guess two. Public comment. You're really killing our time here on this.
Yay. Awkward silence was getting a little weird. Now, if I can read. Ready? The Veterans Assistance Commission provides a variety of essential services for the benefits within the VA for veterans and their families, and we're created by the, it's not in there, but created by the Military Veterans Assistance Act. Next slide. Okay, next slide. So the first one is emergency financial assistance. For the longest time, up till about 2 years ago, that's how our office was created, was for financial assistance, and then it was added to the Military Veterans Assistance Act that we've done VA disability claims forever, or at least since I've been hired about 2005, but it wasn't necessarily in the statute, but it is now. Emergency financial assistance is all the ones listed there. I'm not going to read them all, but we help every 12 months. Which is, it's not every year, it's every 12 months. So it starts over if they, let's say they get assistance in June, then it'll be the June of the next year when they can have financial assistance again. Next slide. VA disability claims, obviously this is predominantly the most of our work. We are, I'm getting old, I can't read that. Oops. Advocate for veterans assisting with filing VA disability claims and navigating the VA system during the process. So from the outside looking in, you'd think that a veteran comes in, they want to file, let's say PTSD, that's the easiest example for being in war. But there's so many other things that we do. We look at secondary conditions to PTSD, and then now Gulf War, Agent Orange. We have to look in, we go through the records, what we call their service training medical records, page by page, and we tell them everything that they were ever treated for. And then we do a full review of records, and then we tell them what we see, and then it's ultimately what they want to file for. And then we follow the claim the entire process. A lot of what I do is make sure the VA does their job correctly, which a lot of times they don't. So I message people behind the scenes and tell them if they made a bad decision or if they did something wrong. I will tell them to fix it without the veteran even knowing. That's probably about a third of my job, is emailing the VA and telling them to do their job correctly. Hopefully there's no VA employees in here. So that's what we do. We are the veterans advocate. We're fighting for them, and we want to make sure that they get everything that they deserve. I do the Board of Veterans Appeals hearings with judges. A few of my staff has done it as well. So we usually do those virtually. Before the pandemic, we'd have to go to Chicago, or the veteran now can come into our office and we can talk to the judge in our office and do the BVA case, which is a federal case. Those usually take like 3 to 5 years to be submitted. So it could take 3 to 5 years depending on how long the VA process goes. So we have to track that the entire process because they're sending VA letters the entire time. Next slide. Now this is what my assistant superintendent does, is the deceased veteran services. This is her expertise. Burial flag for deceased veterans, assistant applying for burial benefits provided by the VA, assistant filing for a survivor's pension to qualified survivors. A lot of people call it a pension, but the difference between a pension is it's off income. It's based off income. So you have to make a certain amount, and there's a lot more that you have to go into about what income the family has. Applying for and ordering a VA grave marker for a deceased veteran, and then the office also provides some monetary assistance for the burial of indigent veterans. That does not come out of our budget. That is the general fund that comes out. We just had one, I think, for $300, but usually 1 or 2 a year that we'll have that the family cannot afford the burial for the veteran, so we will take that out of the general fund. Records, locating military discharge papers with the county recorder's office. A lot of times, if the county doesn't have it, we have to go to the state, because many times the veteran comes in and says, I don't have my 214, it burned in a fire, we moved and I lost it, so we will go get that 214 for them. If the county doesn't have it, we go to the state. If not, then we have to go to National Personnel Records in St. Louis. We provide birth and death certificates recorded within the county. We can get those for free if it has to do with their VA disability claim. Locate and provide records within IDVA. That's the same thing. That's the state office. And then I already said NPRC, which is the VA archives. Next, there we go. So the money brought in, I just kind of wanted to compare 2022 to 2023. New money, we brought in $8.6 million last year. Of total money is $54 million for veterans. We are already at $10.5 million for new money in 2023, and we're at 69 total money. We're probably going to end about 12 or 13 million in new money once I'm done adding it all up. How do we get that? It's not on here, but I go through a spreadsheet, and I have every single veteran we've ever filed a claim for, and I check those monthly. Right now, I have a spreadsheet about 2,500 veterans that I have to check. And once you get them in the system, it's pretty easy. But every time we get a new cost of living, like next year, I'll have to start from scratch and look up every single veteran, what they get paid or what they get their back pay. So it's quite extensive, but I want to have the best records possible. Our team is of 9. Full-time superintendent, assistant superintendent, which is Tricia Collins. We have 5 full-time veteran service officers, 1 full-time administrative assistant, and then 1 full-time support representative, which is the front desk. And that is it. Any questions for me? I knew you'd have questions.
You should have known that. Is it okay? Okay, I had several questions or comments here.
Okay.
First of all, appreciate what you do.
Thank you.
And starting out, in regard, when you speak of new money, what are you referring to?
That's lump sum money. So let's say if a veteran gets $35,000 in back pay, that's new money.
Okay.
Money that they never had before.
That they never had.
Lump
And
sum
then
money.
you calculate that when you speak of new money, I noticed you had say 8,000 something.
Right.
That's new money that you're able to use, or
That's what the veteran receives.
for the veterans?
Yeah.
Okay, yeah, good. And in relationships to mental health, how is that something you would address, or?
So it depends. For the mental health treatment, there's the VA clinic, which deals with that, and then there's a vet center. So we file disability claims. So we get them paid for if they have PTSD or if they have mental health. We try to relate their PTSD to the military service. That's what we do.
And you're like a supportive system for them to get
Correct.
questions answered.
Yeah, and then we get them to the right people. We're pretty lucky in Peoria. We all work really well together. The VA
Good.
clinic, we all have VA teams too. So we have the same program as the VA. So I don't even need to pick up the phone. I can just instant message them, and we are done like that. Social workers, same thing. We don't have to call anybody. We can just Teams message them. And what I say is we're lucky enough to have that access for the veteran, and we know all the people, so we just send them an instant message. We don't call people anymore.
Great. Now, is that the same group that is out in Grand Prairie?
So it's both of them are out there now.
What is that out there? Is it the hospital?
So it's a VA
administration?
clinic, so it's
It's
not as
the
big as a
clinic.
hospital. It's a different term, but yes, that's where they go for healthcare,
Okay.
mental health, and then there's also a part of the VA, but separate. So there's a vet center that's across from Dick's Sporting Goods,
Okay.
and that is counseling, free counseling for veterans,
Okay.
for only combat veterans and MST, which is military sexual trauma. So
Okay.
only that. So it's part of the VA, but it's separate.
Yeah.
That they can go there too. So we work with them every day as well.
Right. So when they have to travel, a distance,
Mm-hmm.
then that's for something exceptional or something unique as far as their care?
Right, so they contact the VA, and then they'll tell them where to go. They can go to the VA there as well.
Okay.
Or now with the care in the community, they can just contact the VA. Let's say if I'm on vacation, I need to go to the hospital, I just call them, they approve it, and I can go to a private physician as well.
Oh, wonderful.
So it's a lot easier than it used to be.
Good,
Lot.
good, great. Okay. Okay, I do have another question.
Go ahead.
In regards to when you mentioned the financial assistance emergency.
Yes.
Now, you did say how often, is it annually that they can receive that? Is there a set amount that they can do annually, or?
There is, I don't have that with me, so it depends on obviously the size of your family and stuff
Okay,
like that.
yeah, that's based on that.
Right, and then, you can only get it every 12 months, but then, it's a one-time
One time only?
emergency financial assistance.
Yeah.
So that's what we tell them, like, you don't want to come in when you're just 1 month behind. I mean, we appreciate that you do come in that soon, but it actually helps if you're a little bit more behind, and then we can pay. There's an Ames grant for utilities as well. So that's a $150 grant. That's not from us, that's from Ameren.
Okay.
So that doesn't count. We used to say if you got help somewhere else, we wouldn't help you, but I changed that rules just because it's better for us to work together and not punish you for getting assistance somewhere else. Now, if it was coming from the same funds, we wouldn't
Different
do
thing.
it. But
Sure, that
yes,
makes sense.
it's best that we work together.
Yeah.
Those are kind of the rules I inherited, and then I changed that as I went along.
Great, great. And I think I do have one other. And are the veterans expected to initiate a reach out to you, or would you know who's in need, or how does that
They
work?
reached out to us. So
Yeah.
it could be, I would say the biggest referrals for us is internal from veterans we've already helped.
Of course, yeah.
I've been doing this a while, so most people around here know me, so they will reach out to me
Great.
on Facebook Messenger or email. I started a completely different email, veterans@peoriacounty.org, where they can just email directly instead of, now I'm the only one that checks that.
Yeah.
I probably shouldn't have said that.
Okay.
But, so I check that, and then status of claims, since they can't get through the phone lines a lot of time because it's just so busy, they can just email me, and I'm actually the one that's checking the status of the claims for them, and just try to get back to them as quickly as possible.
Wonderful.
Because it's a stressful process.
Right.
So if
Right.
anybody needs, that's watching this, they can email veterans@peoriacounty.org, and then I can reach out to them, and we'll get the process started.
Yes, for sure. And I'm sure word of mouth spreads if they
That is the best
do not know about you.
We have, veterans referring their sons, or vice versa, the sons referring their fathers from different eras, and that's usually the best referral that we have.
And your organization is only for locals, or would
For
it be for locals only?
Yes, for locals
Okay.
only, correct.
Okay. Okay, thank you, Mike.
Thank you.
Anybody else? Any questions for Mike? All right, thank you. for the presentation, and anything for miscellaneous. Meeting is adjourned.